Yo, all right. Been getting in a couple debates all over YouTube about healthcare, and it's kind of fascinating because most folks I'm debating seem to think we have a government-run healthcare system, and they blame that for the costs of healthcare. Um, it's really bizarre because we don't have a government-run healthcare system at all. An example of a government-run healthcare system would be the UK's NHS. That's a totally government-run healthcare system. Most other countries have other versions of a socialized healthcare system. Sometimes there's a private provider that's in it, but they're generally heavily regulated as like a public utility. So here in America, public utilities like a water company are heavily regulated. They can't charge whatever rate they want. They have to get permission to charge rates and justify their increases based off of public good. And that's the same in most other countries that have a private health insurance provider. They're regulated like a public utility. And a country like the UK just said, screw it, let's go with a fully socialized healthcare system. Here in America, we have nothing like that. The Affordable Care Act puts some regulations on insurance companies, but they're minimal regulations. It's just very minimal. And as for the cost of healthcare in the U.S. and the reason why it costs so much, that can all be boiled down to private insurance. It's that simple. Why is it so damn expensive to see a doctor? Well, that doctor has to buy malpractice insurance. Now, that malpractice insurance is outrageously high, so the doctor has to pay a huge portion of his income for that malpractice insurance. Now, the doctor in turn has to charge high fees to make up for that loss. Now, you go to the doctor, and now your odds are you're not paying out of pocket because you can't afford those high fees if you're paying out of pocket. So what are you using? Well, you're using private insurance. So that private insurance then sees the high rates of the doctor and adjusts its plans accordingly. And so they raise premiums, they raise copay, and they lower what they'll cover. Now, stop and think about that. Doctors are forced to buy malpractice insurance from insurance companies. We then have to buy medical insurance from the same insurance companies. That's a cost loop, and it's a cost loop caused by private insurance. It has nothing to do with the government. It's private insurance. You could argue that the fact that doctors are required to buy malpractice insurance because of government law, well, that's a fair thing. And now under Obamacare, you're required to buy medical insurance in accordance with government law. True. But that doesn't change the fact that the problem is the for-profit healthcare system. That's the problem. It was the problem before Obamacare. It's the problem now that Obamacare is getting implemented. It'll be a problem when Obamacare is fully implemented. That's the problem. It's for-profit healthcare. Markets don't work on healthcare. It doesn't make sense. You just look at the costs of our healthcare in comparison to any nation on earth. Any of them. Like, it's cheaper in the UK, it's cheaper in Canada, it's cheaper in Australia, it's cheaper in Switzerland, it's cheaper in Denmark, it's cheaper in France, it's cheaper in Germany, it's cheaper everywhere. It's super mega expensive here. And that's because we have for-profit healthcare. If we didn't have for-profit healthcare, it'd be a lot cheaper. It's that simple. It's that simple. Anyhow, yeah, just thought I'd rant a little bit. Yeah.